Hi everyone, this is Allison coming from my home. Today's video is going to be talking about our most frequently used oral motor exercises. So I'm going to be going over some lip exercises that we do in the office, as well as some tongue exercises and then some jaw exercises. In the videos I'll talk about what you should be seeing in regards to the exercises, and then any troubleshooting that you may have to come across in order to do the exercise appropriately. I hope you enjoy. Okay. So the first exercise that I'm going to go over is called gram pops, and what you have to do is you have to put your lips together like this and suck them together and make that labial seal and then that pop. They're called gram pops because when you put your lips together and when you put it underneath your teeth like this, looks like grandpa. So I'm going to show you on my stepdaughter Ava how to do it. All right, Ava, eyes on me. Can you show me how to do pops? Go Good. Can you see the phone? Ready? Go one more time. Nice. See how she has that tight labial seal, nice and tight. Go Gorgeous. If you're having trouble getting that labial seal, what you could do is just have the child or the client go gorgeous. Go Gorgeous. Well done, Ava. Yay! So the next lip exercise that we're going to do is called lip massages. One little bit of concern. If your client or your child or whoever you're doing this exercise with has an underbite, malocclusion, you don't want to do this exercise. What ends up happening a lot of times is if you end up doing this exercise when someone has that type of malocclusion, you can end up fostering that posture even more, so we don't want to do that. Everybody else, this exercise is fine for. Just make sure that your child doesn't have that kind of bite, okay? So what you're going to do with this exercise is you're going to put your bottom lip on top and you're going to suck your top lip down. Woo! Like that. Here, let me show you. Gorgeous, just like that. So what ends up happening a lot of times is I have some clients who have a hard time getting their bottom lip on top. So sometimes what they'll end up doing is they'll try, nope, not like that, Buggy. Bottom lip on top. Gorgeous, just like that. What ends up happening is what I'll have them do is I'll have them kind of move their lip on top of their top lip and then suck down. So use your hand, Bug. Put your bottom lip on top of your top lip. Like a puppy dog, good, and then pop. That's it, good, perfect. It should have that nice contact and that nice pop. Thank you. Next exercise that we're gonna do is called ooh-ee, and basically what this was working on is labial protrusion and retraction. What you want to concentrate on is making sure that your jaw is nice and still. We don't want it sliding as it goes, as your lips go back. We're working on labial dissociation, which basically means that your muscles are doing their own thing independently of one another. So I'm going to show you on Ava. Hey, you. Hi. All right, you ready? So what you're first going to do is you're going to ask your client or your child, they're going to go, ooh, nice and big. Lips should be forward like they're going to be blowing a kiss to somebody, like, ooh. Gorgeous, I love the way you're putting your lips out. And then the second thing that you're going to do is you're going to go E. Lips are back, nice and retracted. E. Good, big girl lips back. E. Good, now we're going to put it together, okay? Ooh. E. Gorgeous. Ooh. E. Ooh. Oh, where's your big E's? E. Good. So what you're going to do is if you have trouble with your kiddo, if they're not getting their lips all the way back, what you can do is you can say, big girl smile. E. Good. See how far back her lips are? And then if you're having trouble getting her lips forward, give me a kiss. Beautiful lips forward. Well done. So next set of exercises that we're going to do are the tongue exercises. So these are a couple of exercises that we do in the office that promotes tongue dissociation and strengthening and awareness. So the first exercise that I'm going to do is called finding your spot, and this is super crucial for your kiddos who are having a hard time keeping their tongue up and behind their teeth. So we're working on those alveolar sounds. Those sounds are, yeah, like L, hold on one second, like L, S, Z, T, D, all those kinds of sounds that require that alveolar contact as well as that tip use. This is an exercise that we utilize to really help them promote that awareness and that strengthening. So what you're going to do is I have a couple of tools here that eventually that I'll show you how to utilize. What I did before I actually touched that is I actually did put hand sanitizer on my hands, so I'm doing it again just to show you, especially with everything that's going on, promote that cleanliness, especially if you're doing anything in regards to putting something in somebody's mouth. So what we're gonna do first is I'm going to have Colby just do it on his own. He's familiar with this already because we've been working on his L's. So, ready, Colby? Look at me. Eyes on me. Show me where your spot is. Good. Pause. Don't say L. I just want to see where your tongue is. Back it up just a little bit, dude. Open your mouth. And then up. Nice job. Perfect. So, a couple of things that I want you guys to be aware of is making sure that your child's tongue is not up against your teeth. See how his tongue is right up against his teeth? That's not where the spot is. So what I'm going to do is I'm going to show him utilizing peanut butter where the spot is so that he's not pushing up against his teeth. I love the way that you're making your L sound, dude. You're doing great. Back it up just a little bit. Ah. Good. This is where your tongue should be, not up against your teeth, man. Up again. Good. Better. Here. Ready? Show me again. Up. Good. See how he has a little bit of space? Nope. Too close. Back it up. Back it up, back it up, back it up. Please and thank you. Nice job. Perfect. Good job. That's where his spot is. That's where he should be putting it all the time. So the next exercise that we're going to do is called side to side. And this exercise is a tongue exercise. It's promoting lateralization of the tongue as well as dissociation. So what you're going to do is you're going to have your client or your child open their mouth up nice and wide. Wideness in your mouth when you have that jaw excursion really promotes that jaw foundation nice and stable so that it gives your tongue to be able to go side to side and get that dissociation. So that's the first step. Open your mouth nice and wide. Usually I tell my clients, pretend like you're yelling at your brother and sister, which you do a lot of. Making sure that his mouth is open nice and wide. And then what you're going to do is you're going to have them put their tongue corner to corner. Ready? Okay, big boy mouth open. Ah. Then corner to corner. Good. See how his jaw is sliding a little bit? Just a little bit. A little bit is okay, but you want to make sure that his jaw is nice and still. Go ahead. If needed, you could always put a little bit of pressure right on his metalis muscle and make sure that he's going corner to corner. Oh, not rapid speed, dude. Last exercise is called tongue protrusion or pointy tongue. What you're going to do is you're going to have your client or your child open their mouth up nice and wide. This is similar to side or that tongue lateralization. We want to make sure that their jaw is nice and stable to get that foundation. And then what they're going to do is they're going to stick their tongue out nice and straight off that bottom lip. A couple of things to be wary of is making sure that their tongue is off their bottom lip and jaw. Sometimes it'll sit on the edge of the teeth. That's okay. Just making sure that they're getting that protrusion. Also, too, sometimes what you're going to see is you're going to see their tip curling. Eventually, what will end up happening is as they get stronger and their tongue gets stronger, it'll start to become straighter. This is working on not only dissociation, but tongue strengthening. In order to get your tongue off your bottom lip and jaw, the sides of your tongue, the lateral margins, have to be nice and tight. This is super important for those students and those kids that need to work on those R's. R is involving that lateral margin tension to get it nice and clear and straight. All right, you ready? Okay, big girl mouth open. Ah. Good. Open your mouth nice and wide. Ah. Open your mouth wide. Ah. All right, pause. Close your mouth. What you're going to do is I want you to have your mouth open nice and wide. I don't want your teeth touching your tongue, okay? Ah. Open your mouth. Ah. And then open your mouth wider. That's it. Good job. All right, close your mouth.